We're talking today with Dr. Irene Ghobrial of Dana-Farber Cancer Institute and Dr. Karen Winkfield from the Meharry Vanderbilt Alliance about multiple myeloma. Now, we've talked quite a bit, in previous episodes about the importance of research in fighting diseases of all types. Now, you have a study that's been launched at the end of last year called the PROMISE Study. What is it, and what do you hope to learn from it?
So we launched PROMISE Study, and anyone can look it up, promisestudy.org, with a very simple question. Why are we not looking for myeloma early? If people are diagnosed with myeloma, and if it's so common, 3 to 5% of the population over the age of 50, 2 to 3 times higher in chance to develop in Black Americans compared to whites. Why are we not looking for it? And we said, well, why don't we ask the question? Start screening high-risk individuals, people at risk of developing myeloma, and see what are the numbers that we find, but also specifically find people who now develop this early precursor lesion, understand what causes for them myeloma, and intercept and treat early so that we completely change the way that we understand myeloma and change the survival. So it's a multi-step process. It starts from screening, understanding progression, preventing progression, and intercepting with early treatment. And we go through all of those steps. The first step is screening, and we launched it nationwide. You don't need a physician. You can click online and sign up, and we send you a kit, and you go to a Quest Diagnostic locally and get your test results, and it's free. And this was truly a way for us to change the way we think of clinical trials. Instead of having it local in big academic centers, change the concept completely, get it to the patients, get it to the individuals directly, because direct patient access is the right way to do it. And we stop having those middlemen, which are the physicians. Right. Unfortunately, that's us.
That's true.
So, and the second question is, it's truly a community effort. If I know someone who's at risk, do I want to know about it early, and can I make a difference in preventing it? I think cancer screening saves lives, and I wish that we can start screening for cancers that we can make a difference. Myeloma is one of them. It's the simple blood test, and we can make that difference. And we're screening now, finding that instead of 3% of the individuals, 10% of the individuals have this early MGUS. And I have to say that MGUS is not that benign. So although, yes, the risk of developing myeloma is only 1% per year, people who have MGUS have a worse immune system. And we know that with COVID-19. That's very important to know. And we have launched a study specifically for that. We know that their bones are not that healthy. They actually get osteopenia and osteoporosis, even in men at an early age. We know there are so many other factors that are part of that, having an early precancer cell sitting in your body and changing your immune system. So by only understanding it early and preventing it early, we can make a difference.
Well, it brings up an interesting point. We talk about COVID. We know that, COVID has an impact on the immune system of people. Having COVID, does that increase your risk of multiple myeloma? Does it exacerbate a condition already present, or what?
So that's an interesting question. I think we don't have enough data about COVID and its late effects yet. That's going to be, the subject of studies for many, many years to come. However, we know that cancer is a dysregulation of normal cell growth and function, right? And we know that the cells that are not working properly in multiple myeloma are the plasma cells. And the plasma cells are part of the immune system. They're the part of the immune system that actually creates the antibodies. And with COVID, we're hearing so much about antibodies, right? They help us to fight off certain infections, including COVID. And so the challenge is that since multiple myeloma directly impacts the immune system, as does MGUS, as you heard Dr. Ghobrial just say, those living with the disease, whether it be the precursor disease, MGUS, or with multiple myeloma, are certainly at increased risk, not only of contracting COVID-19, but also being more susceptible to having worse outcomes, a lot of the sequelae. So I think it's really important to know that while we're not sure yet whether or not having had a COVID diagnosis was going to predispose people to diseases, we do know that people who have certain illnesses, including multiple myeloma, including other things, we know that they're at increased risk, not only of developing COVID, but also being more susceptible to having worse outcomes.
Again,
and we are.
Oh, so go ahead, Dr. Ghobrial.
No, I was just going to say, and we are studying that. So part of the PROMISE study and P-Crowd, which are those cohorts, is asking that question. Sign up to it because we can actually test you for COVID antibody. And then we ask the immune cell questions. And that's called the IMPACT study, which is part of the PROMISE study, to ask specifically that question. What is happening in MGUS and smoldering myeloma? Response to COVID, response to vaccination? Will we have a sustained immune system long-term or not? These are so important for us. And then long term, later on, we can ask the question, will that make myeloma progress worse or not?
Again, I want to go back to you, Dr. Winkfield. Being a radiation oncologist, now you have the ability to deal with patients, with cancer. Now, many therapies, androgen deprivation therapies, radiation has an impact upon the whole system, in terms of bone structure and all of that. So again, does the cancer treatment in some ways increase the risk from multiple myeloma?
It's an interesting question. I think one of the challenges so I actually, while I'm a radiation oncologist, I specialize in blood cancers. So it's an anomaly. There are a handful of us in the nation who that's what we do. So lymphoma, leukemia, multiple myeloma, that's an area of my specialty. And what ends up happening, I see people unfortunately wait too long to actually start thinking about radiation in the management of multiple myeloma. They want to wait till people have fractures, et cetera. And I say, well, let's get the radiation therapy on board sooner when we start to see kind of problems so that we can prevent end organ damage or fractures of limb. And so that's kind of be my PSA for today in terms of saying, can we please make sure that if individuals do have bone lesions in multiple myeloma, that they actually see providers sooner? And to your point, any of the treatments that we have, whether it be a systemic therapy or radiation or androgen deprivation therapy, they do have systemic effects. They impact our body. They do impact our immune system. One of the side effects of radiation, even if it's local radiation, can be fatigue. Well, why is that? There are parts of our bodies that interact with each other. And, inflammation is a very strong mediator of some of those late effects or effects of therapies. And so it's important to know that, yes, any of the treatments that we have can certainly impact risk, not only of developing, infection or increased infection risk, but also may impact our whether or not we actually develop a second cancer related. But let me tell you, the risk of that is so incredibly low. And so our job as oncologists is to weigh those risks. And we talk to our patients. This should never be a situation where we're dictating to patients what they should do, right? It's a conversation. And we always say the patient is in charge, it's their body. But it's really important for providers to make sure that individuals have all of the information that they need to make the best choice for themselves. And we know, again, that with multiple myeloma, starting therapy early on can prevent end organ damage. People will have much better life, quality of life. And so while there might be some risk to starting therapy sooner, we know that those risks outweigh, or the benefits outweigh the risk.
You're going to have better survival, better quality of life.
Yeah, absolutely.
Definitely. Now, again, Dr. Ghobrial, you talked about, the ease of participating. It's basically, it reminds me of the old, and I don't know if it's still old or still done, the colorectal exams where you get the fecal occult blood test. You scrape up, put a little sample, and you mail it back. So it's similar to this. So once someone gets from the PROMISE study and they contact the testing service, and just say they turn out to be at risk and positive for it, what happens? And then how do you then take them through the process of saying, okay, now this is serious or now it's not serious?
Yeah. So we wanted to create that once you are diagnosed, we are in charge in helping you throughout. And we really call it a journey. And we wanted it a white glove experience. We wanted that everyone who's diagnosed, if it's because we diagnosed you, we're going to take care of you. So we have a physician assistant as well as myself and a couple of research coordinators working together that we call the patient, explain everything in details, explain what is the risk, what's the benefit, what's going on indeed. And then we offer them now a telemedicine option to actually see us in clinic. So they can see us at Dana-Farber or any other site. Otherwise, we also make sure that we can send them to a myeloma expert wherever they are. And in fact, one good thing about COVID is it's changed completely the way we do medicine by telemedicine now. And we use that opportunity to provide that care, because if you have MGUS, you don't need to see us in person, but you can get all that care by good discussion, by good options of available clinical trials. But also we make sure that you have a local provider if you need it and when you need it. And we go through that process. We talk to the physician there. We make sure the records are there. And then we go through the history. And I can tell you, we've diagnosed some patients who actually have myeloma, but they didn't know that they have a lesion yet, or who have amyloidosis, which is actually one of the things that we call MGUS that's gone bad. Early disease, but then they start having neuropathy or bad cardiac disease. And we are diagnosing those patients early. And those patients are going to a local physician, starting early therapy as soon as possible. And it's an amazing story. I've seen stories. I just saw online telemedicine, twin sisters. One has smoldering myeloma and one has MGUS. We have families of people who have myeloma. That's so important to understand why and what's going on in this family, and can we diagnose them early? Let's make sure we don't lose track of those families who have been asking us for so many years, am I at risk? And all of us would say, no, we don't screen for myeloma. We need to change that completely.
I think that's wonderful. I think those are very important points you give us, and we're glad to talk to you. We'll be talking to you again soon.
Well, thank you.
Thank you.